Hello, it is an honor to be here. I just want to start sharing my screen and then we will get started. Thank you so much for inviting me today. This is such an important series that Dr. Rashmi Sarkar has put together along with the IADVL EC and IADVL Leadership Pipeline Committee. It really truly is an honor to be here. It's extremely important that we learn from each other and take guidance in the arena of leadership. Leadership can come in many forms, as we all know. It can come intuitively to some, but to others who have a lot to offer, but are a little bit more shy or reserved. A little bit of advice hopefully can go a long way. So I appreciate very much the opportunity to be a part of your journey. And I hope very much that I can help you to achieve your leadership goals. My name is Dr. Mona Amira Gohara. I'm in private practice in New Haven, Connecticut. I'm also an associate clinical professor at the Yale School of Medicine. And today's talk, the objectives are pretty simple. They are to define the term key opinion leader and to give some guidance on how to be a key opinion leader. So the objectives are pretty clear and they're not complicated, but hopefully this talk will provide information for you that can be helpful in your leadership journey. So there are many different ways that people can become leaders in medicine. You can start in your residency, where people are chief residents. You can go on to be a department chair or have an administrative job, such as the dean of students or dean of faculty at your institution. Each one of these forms of leadership has a different path, as we all know. Today, we're focusing on KOLs, or key opinion leaders. If interested, one can choose which arena interests him or her and pursue that course or courses, as often one leadership arena or path begets another. These are just a few of the leadership potential paths in medicine. Again, we're focusing on one, which is key opinion leader, but there are many leadership paths that one can pursue. Before we concentrate on being a key opinion leader, I think it's important to call out the fact that when it comes to pursuing leadership positions of any type, particularly department chair or administrative jobs in academic institutions or heads of professional societies, there are some barriers that people must unfortunately face. There are barriers of bias, and there are barriers of gender and racial inequities which exists. So again, today we're talking about being a key opinion leader, but before we go down that path, I just want to call out these important barriers that may come into play when pursuing any leadership position in medicine or even outside of medicine. So we'll just take a step back quickly before we start focusing on our objective to discuss what exactly a KOL is and how to obtain that. So let's start. I'd like to acknowledge here the work of Dr. Rashmi Sarkar and her colleagues who published and wrote on this very topic of gender disparities in leadership positions. Dr. Sarkar, you can see, published on this in the Indian Dermatology Journal Online. And then also the International Journal of Women's Dermatology, some of our other colleagues in the Women's Derm Society focused on this gender disparity that happens in leadership positions. Essentially, both of these analysis found that women can have lower salaries, less positions of higher academic rank, and less positions of leadership in professional society. So again, this is the work of Dr. Sarkar and some others who are in the Women's Dermatologic Society in 2 separate journals who found similar findings. Women are the majority of dermatology trainees and nearly half of practicing dermatologists. Despite this record number of women entering the dermatology workforce, women still do not have equity in leadership positions, as both of these analyses have shown. In academic dermatology, women hold mostly junior faculty positions, comprising only 31% of full professors and less than 25% of dermatology chairs. And this was data in 2015. Women dermatologists are not promoted at the same rate. Again, this is AAMC, or the American Academy of Medical Colleges data. Despite their higher entry into academics, they're more likely to leave. Now, this is a direct quote from Dr. Sarkar's published paper, which is in the international, the Indian Dermatology Journal. This is a direct quote about gender disparities in leadership positions. The reason for reduced proportion of female professors in academia globally may reside in the fact that female dermatologists do not publish their research works as intensively as men, and experience anxiety because of domestic expectations and the difficulty of balancing academic pressures with the social conventions of families. We may also consider the reasons to be due to inadequate mentoring for women, lack of female role models, the competitive disadvantage for women to obtain grants, women being less likely to obtain research funding, having less ambitious career objectives than men, and self-centered aspirations or lack of autonomy for women. All these factors affect women's career trajectories. So again, I just want to highlight that these gender disparities, as Dr. Sarkar has published in her work, and some of my other colleagues from the Women's Dermatologic Society have published in their work, these gender disparities in leadership positions do indeed exist. Now, it's not just gender disparities, unfortunately. We do see that this data of disparity in leadership positions, particularly when we talk about academia. Remember, we're not talking about key opinion leaders right now. We'll get to that in just 1 minute. I just thought it was important to discuss this. This data is not just women, but it's also a common phenomenon seen in underrepresented in medicine faculty at academic institutions. You can see here that this line, these lines are, and this means brown and black, our brown and black colleagues in dermatology are not as likely to get promoted throughout their academic careers to higher ranks. You can see that here, that the same number of higher ranking professors amongst Black and brown dermatologists has remained the same from 1970 essentially to 2015. So it's very important that for us to understand that there are racial and gender gaps when it comes to leadership in our specialty. So it is important for us to keep in mind that leadership roles may not be all merit-based, unfortunately, and we really have to address this. There are other biases that may be playing a role, and we as aspiring leaders and leaders should do our best to change this trajectory. I want us to keep this in mind as we go through this talk. The point that recognizing the gaps and helping to narrow them should be a goal as we aspire to be any leader. So that's just kind of an introduction before the introduction to remind us again that leadership can have barriers and biases, and there are gaps, both gender and racial. So as we aspire to become leaders, and as we do become leaders, we should keep these biases in mind so we can actively work to change them. All right, now let's get on to the task at hand, which is to talk about being a KOL, a key opinion leader, and how to get there. Before we start, I just want to tell you a little bit about me. I consider myself a KOL, or a key opinion leader. I'm a private practitioner, and I have an academic affiliation at Yale School of Medicine. I'm currently honored to serve as the 49th president of the Women's Dermatologic Society. I've served on multiple committees for the AAD and the ASDS. I work with industry partners and media a lot as well. Those are many of my leadership positions. I'm also a wife and a mom of 2 boys. And I'm not telling you this to brag or boast, it's quite the contrary. I tell you this to let you know that if I can do that, anybody can do that. I am not a genius who changed the face of dermatology. I'm simply a doctor who had a passion and worked hard to make opportunities for myself. And with the help of many, including Dr. Sarkar, I made it. I'm a KOL or key opinion leader because of hard work, mentorship, and passion. So now let's get to our task at hand, which is to talk about being a KOL, key opinion leader. Let's discuss this type of leadership a little bit further. So what is a KOL or a key opinion leader? A key opinion leader is a trusted, well-respected dermatologist or person of any profession with proven expertise and experience in a particular field. This is different than a chair who runs a department or a dean or a head of a lab. This is a person who is an expert in one or more areas and whose opinion is sought out by many different constituents. And we'll talk about that. Being a KOL is not unidimensional. It's very multidimensional, actually, in how to get there and how to apply it. Being a KOL is somebody who's very connected, whereby opportunities in one arena beget opportunities elsewhere. KOLs or key opinion leaders work with many groups. They work with industry, they work with academic departments, they may be in academic departments, they can work with our leaders nationally and in politics. They can be involved in social media, and certainly they can be leaders and members of professional societies. Let's take an example of somebody who is the KOL in acne or a key opinion leader in acne. If someone is a KOL in acne treatment, for example, they will ask to be on advisory boards about the development of different acne medications. That's how they will work with industry partners. They may be asked by industry partners to help in formulating acne treatments. Again, that's how they work with industry partners. They may be asked to speak at grand rounds on acne. That's how they could work with academic departments. That's an example of how they could work with academic departments. They may be asked to collaborate on research studies with academic departments. They can use their expertise to change laws which affect how we practice medicine. That's how they actually can be involved in national politics. A KOL on acne may be asked to testify for the FDA on how certain acne treatments are beneficial or not beneficial to our patients. They can change the face of medicine and acne in many ways. For example, some of our colleagues who are KOLs in acne, I'm sure most recently in the United States, we had a big shift with isotretinoin treatment. Many of our KOLs in acne went to Washington to help negotiate that shift with isotretinoin treatment. They can speak with the media about acne and do social media posts about acne. They can work with professional societies to come up with consensus statements around treatments for acne. Many of our KOLs with acne did this in the American Academy of Dermatology when they came up for consensus statements on Accutane, for example. So being a key opinion leader is someone who has an area, one or many of expertise, and his or her opinion is then requested to work with industry partners, to work with academic departments, to even change the face of national politics, to work and communicate with our media partners or social media, and actually work with our professional societies in their particular area of expertise. As you can see, this is a multifaceted thing This is not just a unilateral thing, like we said in the beginning, it's multi-dimensional. It is certainly not unidimensional. Now, being a key opinion leader is also different than being an influencer. We hear about the word influencer all the time. This is somebody who is very social media focused and usually may have one area of expertise, but doesn't have this broad connection with many different constituents that a KOL does. That is the big difference. KOLs use their area of expertise to branch out and partner with many different constituents as those listed here. Now, being a KOL, like I said, is not unidimensional. It's very multidimensional in how we get there and how we apply it. And it's also very connected, like I said before, whereby opportunities in one arena will beget opportunities in another. You can imagine that a KOL who focuses on acne treatment would, work with an advisory board or industry and then be asked by another company to help them develop acne treatment and then be pulled to Washington, D.C. in the case of the United States to testify. So one opportunity begets another opportunity simply by having one area of focus or many areas of focus that you become the key opinion leader in. People can become a KOL from establishing their brand on social media. They can also become a KOL with many different ways, like we're going to talk about today. The paths listed on that slide so let me go back for a second. So I came up with this whole rule of P's of how to be a successful KOL. And it wasn't something that I just came up with in my head. Yes, I came up with the rule of P's, but the individual components of the rule of P's came from me asking industry partners, my mentors, different leaders, media partners, what they look for in a key opinion leader. So you don't have to have all the P's, but hopefully you have some of the P's. And hopefully one or two of these is your first entree into being a key opinion leader. Let's start at the beginning. The first thing you have to do, the first P or two P's, I guess, that you have to become a key opinion leader is a passion. You cannot be a KOL until you find your passion. Passion is the driving force behind success. It gets you energized and excited to work. Is it acne? Is it warts? Is it global health? Is it diversity, equity, and inclusion? Is it alopecia? Is it complex medical dermatology? Whatever it is, dive in deep. This will be the driving force behind becoming a KOL. In fact, my passion around diversity, equity, and inclusion is what has driven me to be a KOL in that particular topic for many of the partners that we talked about on the previous slide. Industry, academic departments, media, they oftentimes call on me to talk about diversity, equity, and inclusion in dermatology because this is an area of passion that I have developed. The second P that's very, very important, probably one of the most important P's in the rule of P's in becoming a KOL, is people. Nobody can become a leader by themselves. There are always people to their left and right and up and down who are willing to help you, to boost you, and to guide you. Becoming a key opinion leader is a team effort. You must find a mentor. Mentors are critical in the process of becoming any type of leader in medicine. In the beginning of this presentation, I showed you potential leadership paths in medicine. KOL is just one of them, but any one of those leadership paths requires a mentor. There is nothing more important than mentorship or finding individuals or groups of individuals who can advocate for you, connect you, guide you, and provide you with opportunities. It is the single most valuable way to start pursuing any leadership position in medicine, any leadership position. Once you identify that first P, your passion and your purpose and what you're interested in, a mentor can help you to clear the pathway so that you can begin to take your first steps towards becoming a KOL, to be a recognized leader in your specific space with your specific passion. Find a mentor. It is essential. Now, if you don't know where to start with this, and or finding a mentor is, seems overwhelming, I can reassure you that almost every single society, these are just a few listed on this slide, almost every single society, professional dermatologic society, has formal mentorship programs. So do not fret. If you're not connected to a dermatologist immediately or don't have a network at your fingertips, these societies, and any society, mostly has professional mentorship opportunities. The next P after purpose, passion, people, mentors, is presence. This is by far the easiest way to get your foot in the door. Join a professional society. Professional societies really help to connect people. And this is the way that I personally started my journey on becoming a KOL. Joining a committee in a professional society allows engagement. It allows you the opportunity to get to know and share and exchange ideas with colleagues across the country and globe. I'm quite certain, for example, that I would not have met Dr. Sarkar were it not for the Women's Dermatologic Society. It connected us, and Dr. Sarkar has given me many professional opportunities, including this one today. The people you meet in these societies, the connections you make lead to mentorship, which we talked about. That's one of the most important facets to becoming a KOL. Mentors will give you opportunities, and if they don't know who, if they don't have the opportunity specifically at their fingertips, they will connect you with somebody who can. Joining a professional society is a great way to be introduced to and to understand industry partnership as well. When I first became a member of the Women's Dermatologic Society, I got introduced to many industry partners and was given opportunities that then afforded me the ability to actually consult with them as a key opinion leader. Also, joining a committee or joining a professional society gave me the opportunity to start working on my passion around diversity, equity, and inclusion. I actually started the committees, the diversity committees for the American Society of Dermatologic Surgeons and the Women's Dermatologic Society. I started their diversity committees because that's where my passion was. And from there blossomed opportunities with other colleagues, industry partners. Again, one opportunity begets another opportunity once you get entrenched in these societies. It's a great way to branch out. Remember that dermatology is a small specialty. We are a family. Having mentorship and gaining experience in professional societies is paramount. There are always opportunities and programs that can allow you to get involved. And there are so many professional derm societies, some for international colleagues, some for medical derm colleagues, peds derm colleagues, contact derm colleagues, aesthetic derm colleagues, you name it, there's an opportunity. Sometimes connecting your passion with the connecting society is the best way to start. So that, my friends, is our third P. Next, the next P to becoming a KOL is podium. Give lectures at meetings. This may seem onerous or hard to do. You think to yourself, how in the world can I do that? Particularly when just starting out. This is where having a mentor can be helpful. Again, connections are key. If your mentor does not have some gateway, they will know somebody who does. Trust me on this one. Also, reaching out to the chairs of the annual meeting work group committees can help you to suggest a session. For example, when I was first starting out many years ago, I was interested in diversity, equity, and inclusion, and I was also interested in media. And I asked the chairs of the ASDS if I could do a session. I came up with a proposal, and they actually allowed me to do it after approving my proposal. This was a way to get my foot in the door. Once you're on the podium, make sure that your experience is, that the way you convey information is good. Make sure it's data-driven, objectable, reliable. And from a media perspective, make sure it's relatable. Industry partners and media partners like relatable information. The last tip about getting on podium is look at the programs for the different meetings from the year before. See what was spoken about. Reach out to the people for the next year who are leading those sessions, and many times you can connect with them and they are amenable to having you participate in some way. The next P is publications. Becoming a KOL, it's very important to have your passion and purpose, find your people, get connected in professional societies, get on podium and speak. Also, make sure that you have publications. Publish. If you want to be a key opinion leader and you want your opinion to be valued in a specific area, one of the most important things is to do what? Produce data. We base the advancement of our specialty on scientific data. Being associated with the genesis of new information or applications is a quick ticket to the land of KOL. Once you've chosen your passion, write about it, research it, utilize the mentor who can guide you to others who are leaders in this field. Familiarize yourself with all of the dermatologic publications in this arena, who would be amenable to your area of expertise, and submit to many. If you don't know where to start or are intimidated by the publication process, remember that there are societies that, such as the ASTS and the Women's Derm Society, who have journals, and perhaps these are a bit easier to start submitting publications to than some of the bigger journals. That being said, the AAD has an editorial mentorship program that you should consider. Come to your mentors when you are presenting to your mentors. Come to them with well thought out ideas. Having your name be a lead author or amongst lead authors will put you top of mind on a certain topic when constituents are looking for and choosing KOLs. So find your passion and publish on it. Find a way. You can ask your mentors will connect you to somebody who's in an area of that expertise to write or collaborate with them on it. Remember that it's essentially important to publish. The next P in becoming a KOL is public relations. We as dermatologists communicate with our colleagues, we communicate with industry partners, sometimes we communicate with politicians, but most importantly, we need to communicate with who? Our patients. That's our job as doctors. I do a lot of media and happen to just show here something I did for Vogue India just recently about how to treat acne and dark skin. Again, I took my area of expertise, which is diversity, equity, and inclusion in dermatology, and made it applicable not just to some of the other constituents that we talked about, but our patients through public relations. We can have scientific data and speak to our colleagues on podium and publish in journals, but it is also important to communicate with the public from a KOL lens. Like I said, I do a fair amount of media and do not have a PR agent or publicist. This is an example of something I did for Vogue India just a couple weeks ago. And it connects my passion of diversity, equity, and inclusion with public relations. So some of you who may be interested in doing more media in your communities, have your media savvy colleagues introduce you to the editors of newspapers, magazines, journals, online websites that may have something to do with dermatology. You can reach out to the editors yourself. Send them what we call a pitch. A pitch is an idea for them to write about. They're always interested in new scientific data, and they want to hear from KOLs what their opinions are and what the latest and greatest is in dermatology. So you can get the email of an editor and send him or her a pitch. You can contact them directly via email or on Instagram. There are many ways to do that. Another way to work with media and PR is to contact brands. A lot of brands and industry partners have built-in media relations. And what you can do is say, hey, I love your brand. I'm interested in working with some of your media contacts. If you'd be willing to broker that relationship. So that's another way to do it. Also, you can join the media or communications committees of many of our societies. Many of the societies have these opportunities, and news outlets reach out to the societies, and then the societies will reach out to the members to get information on to broker an interview. So there's a lot of different ways you can do this. You can reach out directly. You can have colleagues introduce you to editors. You can join societies where the society will help you to get an interview with an editor through their media relations committee. You can work with industry to work with editors and news outlets because all of them do so. Just make sure that when you do get into that position, that you relay the data in a easy way, a way that isn't so scientific. Make sure that it's in sound bites, small sound bites, and relatable. The next P is to produce. Work on clinical trials to be a KOL. Again, if you're an acne KOL, can you work with industry partners? Can you work with your academic partners to produce data that then again you can publish on and speak at the meetings on? See, all of these things are related. When you produce data, you can write about it in a journal. When you write about it in a journal, somebody's going to want you to speak about it at a meeting. When you're speaking about it in a meeting, certainly industry partners, media, academic partners will want to hear from you as a key opinion leader. If you don't know where to start with clinical trials, contact industry. They have medical science liaisons or MSLs, and they will help you to guide you with the clinical research that they are doing. And that is a wonderful opportunity to get started if it's not something that you have set up in your own office or in your academic institution. The next P is to be proactive. Once you've found your purpose, you've found a mentor, you've joined a society, you've written a paper, you've given a talk, you've reached out to media, all of this takes effort. It takes you being proactive. Don't wait for the opportunity to come to you. You go to the opportunity. There are very specific ways that somebody can do this, but don't wait for somebody to come to you. Send the email, reach out to your mentor, reach out to media, reach out to industry. This is how you carve your path to become a KOL. If for some reason none of the other P's are working out, you can always rely on yourself to be proactive and to reach out to the dermatologic community, which is all one small family, to help and to guide you. There is no questions asked. That I promise you, this is the first right step. Next, of course, and the last, not second to last P, is having patience. You can't give up after rejection. Being told no is part of this whole process. Becoming a KOL, becoming any leader takes time. It takes patience. You cannot, if somebody says no after you ask them once, it may take 5 emails to connect with a mentor. It may take going to 3 or 4 meetings before you're asked to be on podium. It may take submitting to multiple journals before your publication is accepted. Do not give up. Failures are part of success. They are part of success for everybody. Remember that patience is a key part of becoming a KOL. Forge ahead. I promise you will succeed. This is our last P. Pay it forward. Remember, we are in this together. So when you get to be a KOL or the chair of a department or a chief resident or the editor of a journal or the president of a professional society, remember to lift each other up. Give others that very opportunity that others gave to you. This is where we can impart a change that we were talking about in the beginning, minimizing the gender gap or racial gap in dermatology. When you're working with societies, media, industry, give recommendations of colleagues that you know would be wonderful leaders, something that may boost them up and pull them along. Remember, we are all connected. The hardest part of this process is identifying your passion, knowing what to devote yourself to in terms of being a KOL. What is going to get you excited every day to talk about? Once you have identified that, you can find a mentor, and the rest will almost certainly follow. You are not alone. Everything is connected, both opportunities and people. Ask your mentor how to get started. None of these things are siloed. I promise you, this is easier than it may look. So remember the rule of P's. Find your passion, find your people in your mentorship, have a presence, join a professional society. This opens up the doors to many different opportunities. It allows people to know what your area of expertise is and where your interest is. Get on podium. Once you join a professional society, tell people that you're interested in acne or lupus or alopecia. Those people will be running the sessions at meetings. I almost guarantee they'll invite you to be on podium. Get involved with publications, collaborate with people. Be proactive. Don't wait for people to come to you. You reach out to people. Always be patient and always pay it forward. One more thing I just want to say very briefly is once you become in a leadership position, I want to encourage you to do two things. Identify what your strengths and weaknesses are as a leader. Some ways to do this. There are some leadership assessment tools. I actually learned about this one from the American Academy of Dermatology leadership weekend that they have in Chicago. This is one called the DISC assessment. There are many. Take a leadership assessment tool to identify what your strengths and weaknesses are as you become a leader. Also, make sure to identify your biases. We all have implicit biases. Make sure that you can identify those before you become a leader so it doesn't play into how you guide your constituents or guide the members of your committee or guide who you're coming in contact with. So before you become any type of leader, identify your strengths and weaknesses and identify your biases. I want to thank you so much for this wonderful opportunity. I certainly hope some of it was helpful. Please reach out to me if you have any questions or concerns. Thank you to Dr. Sarkar. I'm most appreciative for this opportunity. I'm happy now to engage in our discussion. Thank you so much.